So today we have Amanda Harter with us, who's going to share a little bit about her experience during the COVID-19 pandemic. So thanks for being with us today, Amanda.
Of course.
To start off the interview, we're interested in how working in healthcare was during the pandemic. Could you speak a little bit about that?
So during the pandemic, I was the internal communications manager for our hospitals in the North State area, which was kind of crazy, to be honest, during COVID because things were changing so quickly. You would work on something in the morning, and then by the afternoon, we might have new information that we needed to change or a policy that was being changed. It was very fast-paced and challenging and very busy.
That makes sense. Thanks for sharing that. Can you talk a little bit about people accessing healthcare during the pandemic?
When you don't have all the facts, it's really easy to fill in with fear. So coming to a hospital, to a healthcare facility, they were concerned about exposing themselves to the virus. So a lot of the regular procedures and more of the preventative care that people would normally access, they didn't. It wasn't worth that exposure to them, even though we had so many policies in place and procedures to not only protect our patients, but protect our staff, and it still was just scary. It was interesting, my husband actually had a health incident and it ended up stretching out for months because we couldn't get him in for a procedure that's fairly standard normally. Finally, I had to advocate. I had to go to the head of surgery and just be like, okay, what do we need to do to make this happen? Thankfully, we were able to get him in, and sure enough, after his procedure, they were able to get him on the right medication. And within weeks, he was better with something that he'd been dealing with for months because he couldn't get in. You know, I'm lucky. I have the connections in healthcare. I knew who to go to ask how to advocate for him, and the general public didn't have that.
The fear of the what if and the unknown, I think that's a very human thing. So could you talk a little bit about how information about the pandemic was acquired and then any difficulties you might have had with misinformation and just how to communicate during that time?
So there was lots of information coming down the chain. We would have daily, sometimes multiple daily, times a day huddles where we're trying to gather the information and then disseminate it out. We literally went down to printing out paper copies of the daily updates and standing at the hospital doors during shift change and handing them to staff members to try to get the most accurate information out.
What steps did your organization take to combat misinformation during the pandemic?
To combat misinformation, I think that it was just really important that we were as timely and as transparent with the information we were receiving. You know, there were documents that grew and evolved with questions and FAQs and so many different resources created during that time, but all of it with the goal of really just trying to give people the most accurate information they could so that way they could make the decisions they had to make.
So what are some of the biggest lessons that you learned in the workforce during the pandemic?
Prioritizing employee wellness. Take the time to listen to your staff. You can assume you know what they're stressed about, but you don't know until you ask. And so making the space to listen and find out what's going on with them and then figuring out ways to support their individual wellness, I think is probably one of the biggest lessons learned.
Is there anything that we learned from COVID-19 that would translate to a future pandemic?
You know, we have our agencies that we work with on a regular basis, but in times of crisis, those relationships become so much more important. Taking the time to maintain those relationships outside of crisis situations will set you up very well when something does arise.
United Way, that's what we do.
What you do.
Yeah. For you personally, what was your greatest challenge during the pandemic?
I found out I was pregnant literally right before everything shut down. So being pregnant, I wasn't just worried about myself, but also my baby. That was probably an extra challenge for me personally. My office with healthcare was across the parking lot from the hospital, so I wasn't necessarily in the hospital every day, but I was still, working with people and exposed to people and going in and out of the hospital with projects. Also trying to keep things as normal as possible for my son. He was 3 at the time, and so he doesn't understand everything that was going on. He hated the masks. He's constantly trying to pull the masks off my face because he couldn't see your expression. Trying to keep things as normal as possible for him too was really important.
Did the COVID-19 virus impact your family directly?
My family was very lucky with COVID-19. While almost everyone got sick, we didn't have anybody who was really negatively impacted with their health. I will say that my brother's family got really sick right before Christmas, and so one of my vivid memories from COVID, we went over to his house Christmas morning and we put presents on the doorstep, and then we all backed up in the driveway and are standing in the driveway, and then my brother's whole family comes out in their jammies, their Christmas jammies, and stood on the porch and opened their presents, and we talked to them, across the way because they were all still sick with COVID. It's explaining to my 3-year-old that you don't get to go run and play with your cousins right now, and we didn't get our normal traditions. So that's definitely something that was different.
Can you tell me a little bit about any positive takeaways from your COVID experience?
So one of the things I try to remind myself is taking the time to celebrate the small wins when you're in the midst of a longer stressful situation. When we would have a long-term COVID patient being discharged, so they were finally getting to go home, and sometimes they had been there for months, they would announce over the loudspeakers, it's time for a pause for applause, everyone meet at the main entrance. And so if you could, you drop what you're doing, and staff, leaders, the attending physicians, sometimes it was other visitors, would line the front entrance of the hospital as the person was coming out to meet their loved one to go home. And everyone would cheer and clap. That was much more meaningful than where I try to put it into practice on more of a daily basis, but I like the theory behind it. Taking the time to celebrate the small wins. It doesn't have to be big, it can be in the midst of a longer project, but making sure that you're making space for gratitude. I think that it's easy to get caught up in just the craziness of life and the stress and everything else. And it's really important just to make space for celebrations and for gratitude and to be thankful for what we have.